Like we're just seeing people, that's crazy, people parking the bike lane.
I think the hardest thing is like navigating the transportation system and the rain, and the dark, and the switch, and how it's folded.
Shiny
You
streets.
plan for it, but you don't expect it.
We're recording.
Although I took the.
Okay, Saturday. Yeah, I think we've got, full house for Saturday. Can I see the lady showing up to hang out and have coffee in the morning?
I didn't email it.
That early, okay, I'm gonna get out, okay. So we're planning on Sisters at 9:30, and then, come meet me there, and then we will stroll over by 10 o'clock to the streetcar maintenance facility, where our instructor team will be there, our team are waiting for us, at 10 o'clock. So if you join us at 9:30, and then we'll get coffee and stroll over, or meet us at 10 o'clock there. And for those who want to stay for lunch, I called the Fields, the restaurant, the Fields, it's just a couple blocks away. It's on 14th in Northfield. So they have a room. They asked us to go in a football game. I wasn't really sure what's on. I said we could turn on whatever, but I have a group of about 15 to 18 students for lunch. So join us for lunch. We have a field trip coming up. If you're interested in joining us this Saturday, it's of the streetcar maintenance facility. Our very own congressman sent his regrets for not being able to join the field trip because I did invite him, and he was told by several folks up higher up that he's not making public appearances and all this stuff that's going on. So that's what I learned today. Yeah, so we're gonna work on it. I'm gonna work on getting his signatures on the certificates. So.
And here's out of the job in a couple years, you can do a session in class.
There you go. There you go. I'll bring him back. Yeah. So.
He did a very good NPR interview this afternoon. I was listening to that in my car.
Oh yeah. He did a lot of, a lot of great interviews. So.
His staff are now trying to board it like powerhouse. Public safety isn't created by law, public safety is created by environmental situations, and then more people on transit would expect to take the cue just like.
There's a ton of his former staffers floating around in the transportation world. And you will see, Anno, our very own PBOT equity manager, Wendy Serrano, used to work for Earl as well back in the day. So, yeah, so that's my update in terms of the field trip and certificates. And I want to hear some of your updates in terms of projects. How are people doing on their projects? Remember where you're at right now? Can we share a few things, some remarks, some like, this was not easy to do. How can these interviews are really hard? What kind of solutions are you coming up with on your projects? Or have you nailed down some things you want to share?
The person you referred to was in the and then referred to someone else.
Robin referred to somebody else.
She said it was me, and then I'll give you some more. I had another one, but.
There you go.
Well, my interview was good. I
I already used some PBOT methods.
Yeah.
Through the neighborhood association, so one of them gave me a bunch of suggestions for more practical things in the workshop.
Anyone else?
Was really great. Because it gave us this insight. And go into the federal highway administration. Sorry.
Wow.
Why? Where they get their independence. Same for but it's a formula that everybody uses. Well, sure. They will do this. Go over that there.
Wow, so that's
The federal highway administration.
Federal Highway Administration, what is this? The safe system approach. Can I share this? Can I share this with the students? Okay, so we got some research. I want to share this with our guest speakers today. So a part of this project, this full curriculum work, is a project, their past projects. And this week, the homework assignment really is to go through and interview folks who are already in the industry who can help you come up with some solutions to your projects. And then they'll look at different alternatives and ultimately nail down an alternative. And then this final project becomes their presentation to the end, towards the end of class. And what they do is they're only given 3 minutes to do a presentation to the class. So we'll invite our director of PBOT and all the guest speakers back up again if you want to hear about the project. The impetus really is you only get 3 minutes to talk to council to vouch for your solution. So if your students really only get 3 minutes through their whole research. So this research is really cool because this is federal highway administration. I want to share this with the class. So what it is safe vehicles. The safe system approach talks about safe vehicles, safe speed, safe roads, post-crash care, and safe road users. Redundancy is crucial as much as death, serious injury is unacceptable. Human makes mistakes. Humans are vulnerable, responsibility is shared, and safety is proactive. Thank you, I love that. So without further ado, what I want to do is bring the topic of our conversation this week to class, which is really important and it also brings everything together we've been working on is health equity, public health and transportation equity. We haven't really had much of this conversation previously in this class in previous years. We haven't had much of the interconnections and folks that we know already that's working in the field. And this tonight, I want to welcome back our folks from Multnomah County. And like I said, this is the very first year we've invited Multnomah County to this class. And Michael Walker was here the second night of class. Yeah, and he's shared some really staggering results. And I want to bring back our director at Multnomah County, Charlene McGee, who's with Chronic Disease Prevention and Health Promotion Unit. She's our director of Multnomah County. I gotta get that right. So we got Charlene McGee here, and also with Charlene is Roshin Kurian. She's with Biketown Equity and Partnerships Manager at PBOT. So we've got our two powerhouses who worked on projects together, and Judge really wanted them to be together tonight to talk about this. So this is a really big impetus for us to be together and to share what's been going on across the county and also specifically to PBOT and to Portland. So here we are. Thank you.
So you can use the mouse to. Let's see.
So good evening, everyone. This is fall. I call it Friday Eve. Because I just love to get excited about Friday. But as it was said, my name is Charlene McGee, and I have the privilege of working as the director for Multnomah County's Chronic Disease Prevention Health Promotion Unit. And part of what I'll say, I really didn't consider myself a transportation person, honestly. So probably about 5, 6 years ago, I met Kurian, and one of the ways we connected was she has an MPH, you can hear more about her of course shortly, but she had an MPH and working at PBOT. So just kind of through that, and with the work I was doing at the time, just started to see and understand different connections. I really say that to really just kind of share that, oftentimes, people are like, why does Multnomah County Health Department care about transportation? Why does this matter? How does this connect to health? So this presentation and the work that I've had the privilege of leading the last 5 years through our REACH grant, has brought more light to it. So with that, we'll get this party started. Okay. So one of the things I like to do before I start to talk about transportation and equity work is really just recognizing that the numbers and the stories that we're speaking about, right, aren't just numbers per se. These are loved ones. These are actually colleagues. I'll tell a little bit about stories about some of the evolution of this work. When we got ready actually to release the REACH traffic safety report, as public health, we really try to make sure, the message and what we're putting out resonates with the community. And we started internally, and literally the immediate reaction we got from staff, right? People started sharing that, I too have been involved in a traffic incident. I've lost a loved one, right? So for us, it's just really important just to acknowledge that these are members of our community that we're speaking about. And, I encourage you to take care of yourselves as the story may evoke just different emotions for you through this journey and conversation. So as I mentioned, I have the privilege of leading our chronic disease prevention health promotion unit. Within our unit are sort of 3 different buckets of work. We have our tobacco control and prevention. That's really the part of the work that's the regulatory side of things, right? How does tobacco tie into chronic disease? It is among one of our leading causes of death in the state. Tobacco use, lung cancer. Part of our work also is that we do the regulatory, so we issue tobacco retail license for those who have met the criteria to be able to sell tobacco within the county. And then we have different sort of work where we do different enforcement efforts, because in Multnomah County, you have to be 21 and over to purchase tobacco products. So we have staff who we work alongside to ensure that the retailers are abiding by the policy that we have. And then I have to also acknowledge, we actually just got a great victory that we're preparing for, where we've been able to get the December 15, 2022 was a big milestone. We got the passage of the tobacco flavor ban, including menthol, in Multnomah County, and that's been a 12-year fight. Can definitely speak about that much longer. The next program is the program that I've managed for the last 5 years, and proud to say that we just got awarded our 3rd round of REACH funding. So when one of the 41 grantees nationally funded by the CDC to address chronic disease disparities within Multnomah County's Black population. Within the REACH grant, it's a huge grant. There are sort of 5 different areas, but the area that ties to this conversation is the built environment. And I'll speak a little bit more to that. And then the last program within the PhD unit is the Community Adolescent Health Program. That includes our portfolio program that really looks to support adolescent health, right? Because recognizing that adolescents of today will be the decision makers and those entering the workforce. So ensuring that we're protecting their health and development. We do that through a number of different programs. So working with school districts to build teachers' capacity, supporting youth in developing social emotional skills and learning. And then we also are managing 3 grants right now around youth and violence prevention. So this is a slide, it's busy, there's a lot going on, but just sort of our theory of change of how we're moving the work forward within the county, within the prevention health promotion unit. You know, there are a lot of things up here, right? I think for what we know health and public health to be, is that an individual's health is impacted by so many different issues and factors, right? We know that where people live, play, worship, shop impacts the health. We know at the educational level impacts the health. And we certainly know the impact of race and racism as well on the outcomes of individuals. So through series of different programs, intervention, we work to address those. But really at the nexus of our work are really, you know, communication campaign, policy systems, and environmental change, right? Because research tells us that those are the most impactful and sustainable efforts that we can make to impact the health of the population. So, you know, while I'm leading the PhD unit, this work for us really lies in our REACH program. You know, I think just a couple of things to note about REACH. While the priority population of the REACH grant that were funded through Multnomah County really prioritize our Black and African immigrant community, we also know, right, that through targeted universalism, right, that we're able to center the Black experience in our work. However, it also has this ripple and beneficial effect to other communities and other populations. The REACH work is really, you know, it's grounded in culturally tailored strategies, as well as community-based participatory, where we really mesh public health. We literally listen to any and everything the community tells us to do, right? We have a community advisory board that we work alongside to help us to select the strategies that we're incorporating to the grant to apply to CDC, right? Sometimes like, nope, don't do that. It's like, okay, we can figure out another approach on how to get it done. You know, because we know that, you know, when we talk about disparities and inequities, right, we know that being Black is not a risk factor, right? I always have to say this, it's the conditions in which we're forced to navigate that creates these negative health outcomes. So the work that we do really leads from a place of strength while we are funded to work on disparities. So our approach with our built environment work that ties into our transportation policy. Do you have a question?
Well, yeah, but I can say it when you're taking questions.
I'm not gonna do as you go, I don't.
Just continue.
Okay.
And then we'll do questions later.
Okay. So this is what we refer to as health and all transportation policies, right? As you can see, when we're talking about transportation, it connects in so many different ways to, you know, individuals' health, right? It's access to medical care, access to food, education, physical activity, environmental quality, safety. You know, and I think I want to call out a couple of things here. So within the REACH grant, there are a couple of key, you know, under each of the different strategy areas, there are a couple of things that CDC wants us to do. Under the built environment, and want us to work with the community to promote the health benefit of active transportation, right? As we went out and talked to the community, people were like, we know the benefits of walking, biking, and engaging in active transportation, right? Like that was an easy sell. But the thing that really people pushed back on was the piece around safety. You'll get to see through the presentation, right? How gentrification and displacement have shifted the community into neighborhoods and places and spaces where they don't have sidewalks, right? Where they don't have proper lighting. You know, where when you turn on the news, right, you're seeing images of people who look like you, who are being killed for running, right, and engaging in active transportation. So as we really move this work forward, you know, sort of, you know, this approach of really stepping back. So this is kind of like the framing, right, of a lot of public health work, right? So sometimes you might hear people talk about the public health approach. It's really these 4 different things. You know, you define what the problem is, identify the risk and protective factor, we develop and test the prevention strategies, and then assure widespread adoption. Sort of why this is really important, right? Public health is not direct care, right? We're not, you know, yes, we're tied to FQC, but that's sort of like, that's not the public health side of our work. it's really this population level approach to ensure that, whatever intervention we're putting forth has this ripple, and beneficial impact to a broader population rather than one person at a time. So my son laughs at me all the time, this is everything in public health, because I do think everyone should get a public health degree. If you don't have one, I encourage you to pursue it, because everything connects back to public health one way or the other. So in case you don't know, this is what public health is, right? It's about protecting and improving the health of people and their community. This work is really done through promoting healthy lifestyles, researching disease and injury, prevention, detecting, preventing, and responding to infectious disease. And I'll also say, right, we also know that, the science of things also evolve. I think that was probably a couple of months ago, the Surgeon General released a report on loneliness, right? It talks about how lack of social connection impacts health, right? We also know we're seeing more and more body of research talking about the health benefits of preserving culture, right? And making sure that people are connected. So you'll see through.
Where to get the health benefits of something culture.
I don't remember. So the health benefits of social connectedness. We know, because of that, within our REACH program, we have what's called the cross-cutting theme, right? It's economic development and it's social cohesion. We know that when we look in Portland, right, that oftentimes, right, you don't necessarily see Black people riding bikes, right? You might see 1 or 2 years. So when we do our different interventions and different programming, we do it in a group format, right? Where it may be that individual first time riding a bike, right? There were people who look like them, and that experience helps to carry it to make this a norm, right? And do it more and more often. So we try to integrate like the social cohesion and just culture in the work we do. So we've done bike rides and we have music playing with, we never leave the culture out of any of our work that we do. This is just another slide that kind of just talked about the health in all policy approach that really looks at this global perspective, right? Because I think it's really important that as we talk about transportation, the built environment, and people moving, it's important to also just recognize other things and other factors that are out there, right? We know alcohol use impacts health, right? We know that injury and violence-free living impacts people's decision on how to engage, right? We know, I spoke about safety. People's proximity to healthy eating, right? CDC has this terminology where that was adopted, it's called, safe routes to everyday destination. How can an individual safely get to those routes and places that they need to access on a daily basis? So again, if you learn nothing else, remember policy. So in public health, this is another model theory that oftentimes we refer to, and this is the socio-ecological model, right? It's recognizing that there's these multiple layers and factors, right, that impacts the individual health, right? So with that individual behavior, right? But tying it into that connection to community, right? That individual connection to systems, right? So that can be, even like transportation system, it could be the education system, it could be the healthcare sector. A lot of these issues and factors are interconnected. So, I think the other thing actually too, when we speak about disparities is really knowing that it's not that individual's behavior, right? We're focused on these multiple factors that impacts people's decision. One of the things that we talk a lot about is like, how do you make the healthiest choice the easiest choice, right? A lot of times it's really not that easy for people to, suddenly just get out and walk, right? Or just get out and ride a bike. We hear from community members, it's really expensive to just get on a bike, right? And how do you know what type of bicycle to ride? How do you know what routes to take? I can tell you my own personal story when I try to figure out how to ride a bike, and I'm like, ooh, it's not as easy as just get on a bike and ride. So this is another model of the socio-ecological model that was adapted for physical activity. And again, just looking at how these different factors play, right? So like when you look at the natural environment, one of the things we're actually starting to do more and more of is really incorporating climate. Depending on what's happening in our environment, people may or may not be out there riding their bike, right? It might be too hot, might be the extreme of any and everything. We also know the prevalence of chronic disease, right? We know the chronic disease burden that 65% of Americans have at least one or more chronic disease diagnosis. That's what we'll talk about, and the impact of COVID and how that's, impacting health. So just bringing this one closer to us, this is the 10 leading causes of death in Multnomah County. As you can see, these are chronic diseases, right? What we've done with the 10 leading causes of death is we also have categorized it into, physical inactivity, traffic injury, and air pollution, right? It shows the interconnectedness of the leading causes of death within the county. And actually now if we make this 11, COVID, of course, has now made its list up among our leading causes of death in the county. You're ready for questions.
My understanding is that gun deaths is now top 5. I don't know Multnomah County, but I know the US, in terms of preventable deaths, it's number 1, and it's the top 10 for a lot of states.
You said what's number 1?
Gun deaths.
I don't know if you know number 1.
Okay, my question is like, where's that one? But I guess.
You're saying preventable rather than.
So violence is among our leading causes of death. So let me know, right, so this is 2018. I know we do have more, data was not quite released yet, but I'm pretty sure it's not number 1. I was interested to see where that number 1 is.
Like age group, so.
I was gonna say probably,
Check your sources.
yeah. So I think another thing I love just to call out, right, is that inequities impact all of us. While we definitely talk about the human life, this is the economic toll of what inaction is doing to our system, right? This is the piece of whether or not we choose to do anything, this is what we're all paying one way or the other. And this is specific to Multnomah County. And I'm gonna stop and pause, right? Because I think this is the call to action for us, right? How do we save our system by making the right choices to preserve health and to really promote health? So when we talk about, I start off with the, the slide just acknowledging our community members have been impacted. This is a text message, and I just have to say it, right? A community member, this was a pre-COVID conversation where we're encouraged, I was encouraging this person to go out, and this was the text message I got that night after the presentation. And it was like, I'm scared to go outside between the shootings, car accidents, and people getting ran over. Right, this is people who live in our county, right? This is the human toll and impact of the disparities that we speak about. And then these are headlines from local news, right? These are real. I'll share a quick personal story, and you'll get to see it later. But as we were preparing to release the Reach Traffic Safety Report, we actually ended up having a delay because of COVID. But my son then at the time was 12, and all he wanted to do was just to get on his bike and ride. It was on COVID, so he was like, we're trying to figure out, he's at his grandparents, who live in a poor neighborhood. And he called me, he's like, Mommy, I just want to ride my bike. And I'm like, wait till I come over and be closer to you, right? It's the reality. It's not a simple thing as just going out to ride your bike, right? It's the fear, it's the assumption, it's the what ifs. Even, this is even another really personal story, that Max incident, that weekend that occurred, I was training my son how to take public transportation, right? Like, that's the reality of this work that we're speaking about when we speak about safety and what it means. And I'll say that's why one time in my life, I call it child pressure. I know we say, peer pressure, but I'm like, my child pressure, we can just get on the bus, right? Because that's what his friends were doing. But it was that fear and anxiety. While I took that step, it was also just very, very real. And I know my feeling's not the only one, right? There are a lot of other people. I have other Black mom thread where we're texting each other, just checking in. So bring us to this street traffic safety report. This is one of our key deliverables on what we refer to as the Reach 2.0, so our previous grant. This report, was released and it established the baseline to some information you heard Michael present about. But it established the baseline data around disparities, for Black residents in Multnomah County. It was hard, it was difficult, but yet it was the necessary work that we needed to do. And I'll say, there's just a couple of things to highlight about the report. I'll say, probably up until this report, I was like, I'm so tired of reports, report after report after report, but there are benefits to reports. We know that through the release of the Reach Traffic Safety Report, it has been cited, it has been used to apply for grants where it's brought over 200 million into, the county region. So now I'm thinking differently about reports. But part of our report, right, was really this call to action to acknowledge if we're serious about doing this, we have to do communication campaigns, right, as tied into safety and look at policy systems and environmental change. So within the report, I just wanted to pull this out, right, to highlight and acknowledge the impact of systemic racism on the disparities that we're speaking about today in 2023. This is like the pre-gentrification. Well, Black community, humble neighborhoods where we were. And now people have been pushed further and further out, right? You go from 233 intersections per square mile connection compared to Rockville with 80. That's a stark difference. Right? These are these are the land use policies, these are transportation decisions, right? These are decisions that have been made that oftentimes people who are being impacted didn't have a say-so. I know I've had some conversations with different transportation folks where like, if this 20-year plan will get implemented, I'm like, the people who live there right now weren't even there 20 years ago. So, how do you reel back, right? But the system is also set up to keep going, in a way that is designed to go and move. And I think, that those are some of the hard conversations that we need to talk about.
Can you provide more context for this? I don't know either of these neighborhoods, but what?
So, more context. So Humboldt neighborhood is in inner northeast Portland. I don't know actually, who wants to, y'all know the neighborhoods? Come on, let's make this dialogue.
Sure, I grew through there, yeah. Portland, the other one is on the border, kind of Portland impression. I would not recommend pedestrian experience there. Not
right.
But people do.
Sure, oh yeah.
And Humboldt, part of the historical Black neighborhoods in Portland, and thanks to gentrification and all the policies we know about, harder to live in forward staying community people grew up in. People being moved farther and further, kids having to move farther and further east. Talk to the teacher there.
Mm-hmm.
And then is the suggestion that the more intersections per.
It's safe for people to cross.
Which is surprising as a kid, like crossing the street is dangerous, but the reality is the more.
If you cross the street, not an intersection.
Yeah. The more intersections, the slower cars are going.
You have complete sidewalks,
Yeah.
traffic lights.
That's the benefit.
So these are the, yeah. Y'all got the answer, I'm stuck. You said Christmas? No.
Also, in a neighborhood where there are larger blocks, it's much less easy to walk to other social connections, services. It's a lot more isolating.
It's a weird path in Rockville, so you gotta walk weird out of the way in order to get.
Right, so think about that too, right? Like that connection to everyday destination. Walk, road, bike.
The bus routes make less sense probably.
And I'll say just a couple other things to call out. Rockwood is also it's the poorest part of the county. It's also the part that, they actually had lots of COVID deaths and infection. It's where, our low income community, and I'll also say there's also the most diverse part of the county where over 150 languages are spoken.
It's a great little
It's
park.
beautiful. I mean, yeah, we do work in, the Rockland neighborhood. That might be a fun field trip, if you haven't been to the Rockland Market Hall.
Yeah, the market's amazing. That would be fun. Next year.
That's some work we supported, yeah.
Yeah, take the max out there. That's a big one.
Mhm.
It's such a up and coming neighborhood, though. There's a lot of emphasis. There's even a Rockwood CDC out there. There's been a lot of community-based organizations doing a lot of work. A lot of good work out there.
A lot of grassroots,
Uh-huh.
we can talk about that, could be a whole project.
Anywhere else.
I'm not talking about that part of it.
My emergency office.
It is, lots. Me too.
I was just gonna say, I think it was part of like unincorporated Multnomah County too, which
Mhm.
means it didn't get the investment that a lot of other parts of Portland did. So,
Yep.
like, buying sidewalks and
Yep,
stuff.
that's another part. So you have the Gresham Redevelopment Commission. I love Rockwood. That was, I mean, it wasn't the part where I grew up in Portland, I didn't go out to East County, honestly. I've been out to East County more times in the last 5 years than I did my last 25 years living in Portland. I didn't mean, want me to slide through this because Roshin, okay, you did, okay. So in the traffic safety report, these are the 6 domain of traffic safety that we acknowledge. So we're looking at fatality injuries, the fatal injuries, non-fatal injuries, biased behavior among road users. I don't know how much the data to go over, how much Michael covered, right? But it's, it also speaks to, Black men waiting 30, actually that's a PBOT report, where Black men waited 32% longer for cars to yield at a crosswalk in Portland, right? There's implications around what that means. Oftentimes we say, right, whether or not we're walking, biking, or passengers in cars, there's disparities that exist around bias policing, harassment, violent crimes. It's real out in Portland. So as I mentioned, one of the things, again, that, for us that's really important is just really calling out the policy systems and environmental change, right? It's about altering the physical spaces within the environment. It's looking at, systems change. How do you reinforce accountability? Policy change is correcting historical injustices, and then communications. How do you center behavior change and equity into the communications campaign and work that's happening, right? So as an example, you think about, that 32% of Black men waiting longer at a crosswalk, right? How do you do a campaign to humanize Black men, right? So now when people see them at the crosswalk, they stop. And I can tell you, I've been in the crosswalk, cars it's like Russian roulette, it's.
I had the opposite experience. Like, when I heard that, I was like, really? Like, I come here across my stopping, if what, like, it will stop before I even get there.
Actually, we had a community member, it's one of the, it's actually my pre-COVID conversation we started. Where they, ended up being this long conversation around jaywalking. They were like, it's a senseless law, like, why does it even exist? We are also from like our immigrant and refugee communities, where like, I didn't know I was supposed to cross, right? But I crossed in the middle of the road and I ended up getting it, right? We heard from community members who, son he crossed the street in the middle of the block. And that was his first interaction with police. Ended up being a very traumatic experience, right? People are like, y'all need to try to get rid of jaywalk and make it a thing because it doesn't make sense and it's causing more harm. And some may argue. So these are just some of our tips and what we've learned around the Black experience with active transportation. We know the importance of centering Black voices and supporting Black leadership. There's a colleague of ours actually now who works for the Department of Transportation, Ira Mariam. A lot of this work started engaging around this, and oftentimes we'll talk about literally this is what it means having that Black experience. Honestly, I think that's why we're able to have success with the Reach Traffic Safety Report, right? Because it was a Black program that led, a Black manager. It was the community voice that helped to push. I'll say one of the things that we definitely have learned is seeing the power of just building relationship and building organizational capacity. part of our grant, we intentionally work alongside Black-led and serving organizations, right? We pay community members to sit and serve on transportation committees and boards, right? Because not paying, it's a barrier at times. Helping people to understand, when we first started, it's like, what's active transportation? What does that even mean? So it's like you literally sit and you break it down, right? And I think the piece actually just around us about really organizational capacity, it's not that a community don't understand the transportation world, right? It's just that sometimes the way the transportation conversation flows, you have to translate. Sometimes I'm even like, wait, what does that mean again? Can you translate that to English? Because you just talk a lot of transportation words and I'm not quite following. Part of the work really honestly is about building power to release your own, right? It's building that community perspective, empowering them to know and understand the power that they have with telling their story. Because oftentimes, when our community members are sitting at those tables, their voices and stories are so unique to the conversation that it can really shift the dynamic. I can probably go through each of these, but I think the last one just to pull out is being activist for equity-focused data and research, right? If you're really making decisions based on data, it's important to center equity, because I guarantee you will see it in the work. I think one of the things too, I can say what I've learned from doing the reach work. Sometimes people will say, why does this focus on the Black community? I'm like, let's look at the data. And then when we do it, I'm like, and the work and what we've been able to accomplish, do you see how this benefits you as well? People are like, actually it does, right? That center in the Black community and or communities of color doesn't mean that it's excluding other people, right? That it really benefits all. There was actually this, I forgot who wrote it, but it's called the curve effect. And, oh God, I can't remember the author. But really what that article talks about is how when the curves, right, what building design, it was supposed to be for a community. However, it has this ripple and beneficial effect, right? So that mom and family who might have the child in their stroller pushing it, right? There are times when we can make policy that really has this ripple and beneficial effect for all of us, and we shouldn't be afraid to make those decisions to really make our environment safer for all of us to move and navigate through. And I'll probably, let me say the seventh one to also just call out, it's really important to know the history of the community, right? And why that matters. Coming into a neighborhood to just make a decision and not understanding is very, very problematic, right? There are culture and things to be preserved, right? Where there might be things to correct, it's also important to understand and bring those people alongside you as you make those decisions. And lastly, what I'll say, right, you're all leaders. My team, when we talk, I'm always like, don't say that title, I just don't like the title. Because we all lead from where we sit, right? You have that power to make the shift and to create this world that we're all striving for. You don't need to have a county, right, county commission or city council, yes, right? But you also have that voice to lift up, to help to move and encourage and facilitate the change that we know that needs to happen. And then just more learnings that we've been able to do, I probably said the last one, right, is that connection between public health, transportation, and urban planning. There are lots of opportunities to connect as you go out and move this work forward. I think that's it. Thank you very much. That's what.
How is your,
Let's take some questions now.
how does your department work with PBOT, climate, and organization? What they're referring to, it's like, how does that feed back?
So do y'all have lots of meetings? So we actually have standing meetings. Honestly, we apply for grants together. Actually, with this next round of reach funding, we have actually we got a letter of support from all of them, right? So like as an example, right, for TriMet, some of the work that we have noted in there is that, no surprise, I know, Prime have seen decreased ridership, right? So some of this work going forward is how do we partner and collaborate to increase, ridership. We partner with PBOT, Street Trust and other folks to do different active transportation. There are times when, you know, different policies might be happening where we can connect and explore and sort of see how we're able to move some of those forward. And you actually get to hear about something that Roshin and I partner on, you know, so we do it in different ways, right? And again, I probably say I'm like one person in the health department, right? Because you also have Multnomah County Transportation. There are lots of connection, a lot of ways, a lot of conversations. It's your time.
I wrote the question down, so, first, thank you for this, there's a few, but actionable things that I'm gonna pop in. So, before joining this class, I met Richard, on the PAC committee. And one of the issues we had was, like, this committee sees what's happening, and it feels like it's on a deaf ears. And you had mentioned in that your community health approach, like blank, and we listen to our committee. And like, what does that mean? What, like, can you see?
So, I mean, what I'll say about that, right, is that, so I'll say our REACH program and our Achieve Coalition, right? The Achieve Coalition started, I think now, 12 years ago by community members who saw health issues and challenges in the community and wanted to do something about it. They didn't wait for anyone to do it. They started, the county learned about it and started to support their work. So sort of like that history of it for me being the manager is like really important, right? Because the community, talk about self-determination. As we move the work forward, right, there are times when I'm limiting what I can do as a government employee, but they know what they want to do and they can move it forward, right? So some of this work really is about building partnership, it's about listening. You know, I'll say it's about moving honestly at the speed of trust, but we've been able to build authentic relationship. I mean, we're literally when communities like, that's not gonna work. I'm gonna listen, you know?
If you're like creating, writing grants, this is a committee, this is a group you're gonna ask their input.
Yeah, so our Achieve Coalition is our community advisory boards, our REACH grant.
So to flip it, right, if you had submitted a grant that related to this group's purview, but didn't ask their opinion,
We wouldn't
that would be
submit
a
the grant.
violation of their trust.
We wouldn't submit the grant though.
So I think that's the opposite of what I've observed with some of the transportation committees in PBOT is there's stuff that happens outside of their purview, which is like frustrating because it's not paid. So I'm glad that you're doing it the other way there. Sounds like we need more people with your attitude.
They probably have, but you know. I mean, I wanna say that I don't know like all the intricate details to that, right, because it could be reasons and I mean, no. But I don't know, I'm just saying how I know what
You touched on how when you're working with communities, it can be kind of difficult when planners are focused on this like long range, you know, like, oh, we have this 20-year plan or like the Portland 2035 comp plan, like these kind of big ideas versus like community members who are like, no, we need tangible change in our community now. How have you found the experience of kind of trying to bridge that gap between those two sorts of focuses and concerns?
So I'll say part of our work, honestly, too, is about being honest and transparent about what we can and can't do. You know, I'll say that we honestly have also been able to see some really great achievement around transportation work, believe it or not, in our city. Like the transfer of 82nd. That was major, that was historic. But it was also decades and decades of work, right? So part of that is just talking to the community. Policy change honestly also takes a long time, right? When I started talking about tobacco flavor ban, it was 12 years of fight to get us where we are today. We're still going through, you know, different challenges per se, but that's the nature of our democracy, right? You have to trust the process. It's not easy, it's long, it's hard, there are times when it's convoluted, right? But it's also the importance of staying the course. And continuing to fight, right, for what you know is best for the common good. It's not easy, trust me, there's some days where I'm like, oh, why does this go so slow? Thank you. There you go, too.
Hi, everyone. Roshin, Kurian, so happy to be here. Thank you, Preach for inviting, Judge for inviting us. Didn't even know that we knew each other. So when we met for our meeting, you know, it was actually amazing because I hadn't seen Charlene in so long.
And I say, I'm sorry, because I got very busy, tired.
I mean, she was busy fighting COVID and, you know, handling some big things.
We're so lucky tonight.
It's amazing. This is actually 3 years, like, you know, we connected 5 years ago, but then we wrote this grant together, and so you'll hear about Prescriber Bike, PDX, which is something that we worked on together, but I'll kick us off just telling you a little bit more about myself. So I'm Roshin Kurian again. I use she, her pronouns. I'm currently the Biketown Equity and Partnerships Coordinator, a lot of movement and title changes going on at the Bureau of Transportation. I am from public health. I have my MPH in epidemiology. And I would agree with Charlene that public health is a great degree, and out of all of the money I've spent at school, all these things, I would say public health has been the most influential, impactful, and helpful for just life and how I'm able to move through it. So again, happy to be here. I was in Brooklyn before this for around 7 years. I grew up in Atlanta, so very car-centric space, to New York, which is kind of a different space in itself. I spent a lot of time abroad, where I did my master's, global health, and worked for the CDC for 6 years as a fellow. I kind of moved around in chronic disease, emergency management for a few years. That was a lot. Public health emergencies like Hurricane Sandy and Zika and Ebola, and then I was like, I gotta get out of this world a little bit and not have 3 phones to keep up with and whatever else. So I found myself in active transportation through Department of Health and Mental Hygiene's Center for Health Equity out in Brooklyn. So then I got connected to active transportation, biking. I grew up biking in the suburbs of Atlanta. I biked in college. I biked in New York, begrudgingly, but because instead of taking 2 trains, it took me 45 minutes, I could ride 20 minutes on my bike. So that's how I came back to it. And I piloted the prescriber bike program in Brooklyn that we had a year worth of funding, and moved here to Portland 5 years ago and wanted to bring prescriber bike love to every city I was in. I joined PBOT, and yeah, I would say more public health folks in transportation is the way. Just what we're gonna go over, just our partnership, how we came to be, what transportation and health looks like. So if y'all have been asking what it looks like to work together, I can give one small example. There's a lot of examples, but we'll just share about our partnership. I'm sure y'all know what PBOT is, but kind of where I sit in there, what Biketown is, what this Prescriber Bike PDX program, kind of our outreach approach and how we connected through the health department, through clinics, through schools to reach people. Evaluation, we're at the end of our 3 years, so jumping into evaluation and kind of following up with what's next. So as I mentioned, Charlene and I met some years ago and talked about Prescriber Bike in Brooklyn and wanted to do a similar program here in Portland. And it was nice that I was situated at Biketown in our active transportation, because it helped me work decisions and spread the voice of what we're actually hearing and put stations where they're supposed to be, things like that. So we've been working for the past 3 years with Multnomah County Reach. And Lyft, as you know, is, as you may or may not know, actually, operates and owns Bike Town. So I'll just share. Yes, it does. Yes, I'll get into that a little bit more. Just a quick glance of PBOT. You might have seen this image before, but these are some of the assets that are managed by PBOT, and I just stuck this lovely little orange Bike Town in here at the top. Wasn't part of the original design. We do not own the bikes and the assets, but we do manage them through our programming and with our partnerships with Lyft and Nike. And so here we go. I want to see who I'm talking to. Does everyone know what Bike Town is? By show of hands. Everyone? Oh, wow. It says everyone ride Bike Town. Okay, about less than that. The folks that ride Bike Town, do you like Bike Town? Are you a fan of Bike Town? Okay, a little bit mixed. Okay, all right, good. Real time. I like that. I like getting that feedback.
I didn't know like the teams that were 59 cents a minute.
Okay, good to hear. Yeah,
There's no like kind of hard to
yeah, so these are some of the things that I'm here to hear and do something with. So I appreciate hearing where y'all are at with Bike Town. So we started in 2016. I mentioned we contract with Lyft to operate the system, and Nike is our title sponsor. That's why you see the swoosh all over our bikes. We manage our equity programs. I manage the Bike Town for All program, which is a program for folks living on low income, and Adaptive Bike Town as well, which is our program for folks living with disability or who cannot ride a traditional bike.
Did you pay Lyft to build Bike Town, or did Lyft pay for the license to operate Bike Town in Portland?
So originally, we owned the assets, the city owned the bikes and the assets, and then we were told by council and taxpayers to not pay for the bike share system. So then we changed into more of a permit contracting type of system. So they have sole ability to operate here, but they own the assets, and so that's how it's transitioned now. But as we're seeing with more adoption, with more ridership, there's a need for more money and more investment from the public side. So I think that's kind of where we're at right now, and trying to offer something that's helpful and, you know, as abundant as possible, but with these like limitations.
So they pay to operate here, conceptually.
Yes, and Nike pays to help operate it as our sponsor. Question. So as I mentioned, Bike Town for All, Adaptive Bike Town, Prescribe a Bike PDX. This was a grant that we wrote together for 3 years. It's from People for Bikes, and so it takes Bike Town for All another step forward, brings us into clinics. Also started connecting to high school students, because as we brought the e-bikes on, the age decreased from 18 to 16, so we saw a need to educate our rambunctious high schoolers on how to operate these, you know, powerful bikes that are a little bit different than a pedal bike. Yeah.
Can I talk about the lifting again for a second?
Sure.
Did the city contract with Lyft, do you know when, or was it like before or after the jump got bought by Uber? And would it have been easier to just have the company that was making bikes and the other ride sharing app that owning the company?
Yeah, we were working with Lyft before the e-bikes came about, so there was some transition and partnership. A lot of things had been developed from before. The Uber jump thing happened right as we were in the middle of our process. And so that actually threw a big wrench in the whole process. And then we had to say, well, this is what the offer that's on the table that Lyft had given, and are the other folks able to meet that same offer? And that wasn't the case. So Lyft had the best proposal for our request for proposals. They were chosen to operate with us when we switched to the new e-bike enrollment contract. Cool. As you may or may not know, the way it works is bike share. It's you can access it through your phone. If you don't have access to a phone, you can request an RFID card. You can hover it over the barcode, and it unlocks the bike. Ride, and leave it wherever you end your ride, preferably at a station. But if you can't find a station, you can lock it to something. And then we have a super hub zone east of 72nd where we don't have that many stations. So we have a free lock area that you don't get charged that $1. It's all different depending on what programs you're in, but that's kind of how it works. So I mentioned prescribe a bike. This was started, these are some photos, go actually to our timeline and I'll go back. So I mentioned 2016, Bike Town launched, 2020 was September, we had our new e-bike fleet. Another thing that happened, I piloted with a colleague of mine in Safe Routes to School, a transportation academy that was in Alliance High School, Meet Campus. During COVID, a class of folks, we didn't get to see their faces for most of the time, but we did get to go in person and connect to the bikes, sign them up, and then see that excitement and teach some of these safety and transportation pieces that get lost with driver's ed, things like that. So this was a pilot that we did in partnership with PBOT, and then we launched Prescribe a Bike in 2021. COVID amongst that, so really trying to get into clinics at that time when patients have not so much time with their providers and everything that's going on in the world, whatever. To talk about bikes in that short amount of time just seemed a little too much, and for our staff to go into clinics as well. So we started working outside and doing a bunch of outreach outside of the health centers to connect that. Our Transportation Academy and Safe Routes to School received some funding to expand this multimodal education curriculum. And so now we're at a point where it's absorbed some of our Bike Town for All and Prescribe a Bike information, and we're at the end of our grant. So I just wanted to go back to that a little bit, or just to give you an idea of where we're at. Okay, so I mentioned Prescribe a Bike Brooklyn, 1-year grant, and I left. I think there's still some continuation, a lot of people moved around, but if other folks have questions about that, I'm happy to share later. I mentioned PBOT and REACH working together with Bike Town. So what it provides is the Bike Town for All membership. So that's 60 minutes of ride time at a time, like you mentioned. You get $7 in ride credits every month. So if you do park outside of the station 7 times, that's covered. Free bike unlocks. And then we really wanted to connect to that safety piece and connect them to helmets and safety gear, things like that. And also understand the account, a little bit of the customer service account side, why people end up having delinquent accounts, things like that, to make sure that they're having an enjoyable experience. So just some of the goals. It was tough in the beginning. It was tough in the beginning to connect to people. Folks were trickling in, and then we got connected through student health at McDaniel High School, and then that really kind of blew things up in terms of getting students on board. So we really just wanted to focus on standing this thing up, making that partnership. It took a long time in Brooklyn to even get that partnership going with Better Bike Share Partnership, Interfaith Hospital, Woodhull Hospital, all of that took so much time. And so we want to develop that relationship, figure out who our champions are in those different spaces, who's actually connecting to patients and to students, and can we actually sign them up for Bike Town for All? Can we deliver this education? Can we get helmets to them? All of that needed to be stood up. We do care about physical and mental health. It's a little tough to track, and what we learned through the process was the data that in terms of privacy, but also the data wasn't good data. So it wasn't being tracked properly, and we still need to work out that piece of collecting physical health data. All we have right now are pre-survey, post-survey of self-reported mental and physical health. Longer term goals, we would love for this to be covered by insurance companies or government subsidized, or other partners find ways for them to pay for people's bike membership.
When you say the data we collected wasn't like suitable for the investigation you're doing, is that like under the auspices of like CDC and critical research and peer review, or is that to like, I feel like a lot of government decisions are made off the cuff. Looks like a good idea, no complaints about us to continue, like if people are in photos smiling, I want to bet that's enough. Sweet. My work is I build data systems, and like I'm astonished at how irrelevant they are.
So the sharing of that information is obviously, that's something to think about. And then when we're looking at EMR at different clinics, what they're actually collecting, if that is up to date, that's what was kind of messy when I was asking the clinic leads, like, is this good data? Are you all tracking this? Is this something that you're checking each time you check in with a patient? And that was really the case, right? So that was a really good source of getting like blood pressure and, you know, A1C and all that. Those are the kind of parameters.
What would the outcomes? So let's just say we did have like good data that track blood pressure, you know, like what would you use that information? How would that yield to this program?
I mean, that would show that it's working, right? It would show that there's some kind, if there's connections to, if people are reporting, I'm writing, I'm moving more, this is helping me make better food decisions, and other physical activity choices, like there's a way to associate that reported information with health data. So that would help us tell this story of how much does this cost, like what are we costing overall, like what is this preventative measure costing us longer term, right?
And are the implications for that, like, I'm not understanding the implications for that, other than if we publish this like in a peer-reviewed journal, like, yes, that would stand up, but outside of that.
Well, but for insurance, the insurance companies have like their actuary tables and.
The health insurance company can have this.
Yeah, if an insurance company sees a reduction in risk
Exactly.
and sees they have to pay, have fewer surgeries because their diabetes patients are controlling it better, then they would be willing to pay for it.
Exactly. Just like they have like gym reimbursement programs, you know, there's different programs for insurance companies. There's other avenues.
It's like
promote
food prescription.
food prescription,
Are those
prescriptions.
based on the critical research, or are those because someone at the top wants to signal that they care about X, Y, and Z? Like my work compensates my membership, because they want to say that they care about their employees. I bet they don't care about the research.
I mean, I'll say, from what we know the research to be, right, we know that there are health benefits of people being outside, right? There are actually models of where, providers are writing prescriptions to go outdoors, right? For use to go outside. For people to, I mean, we're gonna get this with Shane, this is about to be moved into this, some grant, we just got, they don't know it yet, but we're about to do that. I mean, right, because, so that if you look at Oregon right now, Oregon is actually leading their way around Medicaid. Are you familiar with like the flex funds? But, so what that is that the flex funds are set up for Medicaid eligible members, right? And these are funds that the provider can refer them to utilize if it has a health benefit, right? So like in one of my previous work, I led the refugee immigrant work for the county. So like if somebody came in, say that part of their transition or adjustment into county, they needed to have stable housing. that was deemed medically necessary, and we're able to utilize those funds, right, to stabilize them, right? So it's a similar concept around, you know, this prescription RX, right, that, I mean, we know, right, by engaging, CDC has a document, engaging in our more physical activity decreases your risk of chronic disease. Yes, there are other factors, but we know that increased physical activity does have a health benefit. You know, and I think, you know, one will argue, if the health system is benefiting from this, should it not pay for this? Right?
I didn't realize there's a literal medical prescription.
Oh, yeah, Google, prescription, it's like outdoors, walking,
I mean, just
physical activity.
the politics that we've been exposed to this class is enough to see the word prescription and assume it's a medical prescription.
Yeah, you know, and I mean, I think, right, that's like part of, honestly, I get really excited about stuff like this, right? Because this is like that systems change work that needs to happen, you know? Like honestly, I think we are getting stepped into the space of, you know, we know the health benefits of what it means to bring people together to celebrate. Our system should pay for every accident. Right, it has health benefits. And I'm like, I'd rather the community benefit from that saving versus healthcare to keep that.
I think to your point also, like, this is a pilot, a lot of these are pilot, we don't know what we know until we learn it, right? So we have to collect the data first, and we have to look at it and see, what is this even saying? Is this worthwhile? That's the point of this pilot, that's the point of the grant, is to be a living lab and try something new and flexible and see, how do we adjust this? And then at the end of 3 years, if we're like, this is a waste of time, and this is what our data shows, then we won't make it from the program, right? And so that's what, that's the opportunity that we get through this grant. And there are other cities, there's 4 other cities across the country who have implemented similar ideas, like, you know, something youth focused or a bike library system or whatever. It's different ideas in different cities. So it's part of the learning and what should we do with it. So it's good to hear like the connections you're making about it though. So I mentioned that we did the Transportation Academy curriculum. Our project manager from year 2, and Prescribe a Bike is now in Safe Routes to School. So had a nice transition of bringing that work into Safe Routes to School into high schools. So we really wanted to focus on education and safety because we're putting bikes in new parts of East Portland, North Portland, there's 82nd, there's 122nd, there's all the things going wrong, going right and wrong, whatever it is. And we heard from Charlene, you know, that it doesn't look the same across the city. And so we want to make sure we're not being reckless, and part of people being hired at these different spaces who care and who are part of those communities. I think that shows out in some of this work and how we connect to people in the community. Yeah.
When the high school diploma came out, were you partnering with the high school to build these new high schools? Like town bikes on site?
Good question. We just started working with the high schools last year, so not sure when those remodels happened. I wasn't working on with the schools at that time, but I will tell you that all of the schools we've partnered with have bike town stations now. We've put in a station in McDaniel. Lincoln does not, but we've been focused on North and East Portland and kind of where.
You're just getting used to it.
Exactly. So McDaniel, Park Rose was a neighborhood that when we were part of the service area, we heard from the community they wanted Bike Town there, so we brought it out to Park Rose. There's a station at the high school, and so we were doing Transportation Academy at some of those places. Yes.
That's a good one. Does the city have a say in where the stations are? Yes. So it's not just a lift, you know?
No, we work together with, we have a station siting team. I work closely with them. It's pretty cool. We have stations now at all the clinics. Mid-County's coming soon. Northeast Health Center has one. North has one close enough in St. John's. La Clinica has one at Kurian Killingsworth. New La Clinica is gonna have one as well, Mid-County, as I mentioned, and Southeast.
Super quick follow-up, does the city understand how many bikes
We push for the most, yes. Yeah, we have the contract, you know, we push on what we've agreed to in the contract, for sure.
Are all the bikes e-bikes?
Yes, they are all e-bikes.
Do you track people actually pedaling?
That's an interesting question. It's a pedal assist, it's not a throttle, yeah, it's not a throttle, so you do have to pedal in order to move.
Speed vehicles. So touching on the, like station locations, I know like some, decommissioned streetcar platforms have been turned into bike town stations. Do you have like the team that does station siting, like, do they have criteria for like what would make a good location for a station? And do they, I mean, it helps that they work with PBOT because they're working with the right away. But is there kind of like, I'm curious about the thought process that goes into like scoping out an area for a station and then like actually getting it installed.
Yeah, and to clarify, the station siting team is in PBOT, it's my colleague, Brian. So he's leading that, and we work with Lyft and notify them when we have clearance on our side to deploy a station there. So that process, there was a wave of input that we took for the last round of station inputs, and so that kind of gave us some points to work with. We look proximity to transit, density, where there's housing density, where a lot of people are affordable housing, schools, health centers are partners. We need the right amount of space on the sidewalk or in the street. East Portland land use looks different, as we know, so there's trickier places, or there's trickier to site a station in East Portland, but there are a lot of factors. We look at our health equity or our equity matrix. We see where the concentration of rides are. Yeah.
I was gonna ask about the concentration of rides, if you have data on where trips are beginning and ending, if that helps inform like where.
Absolutely, and we also look at scooter data, because scooters are citywide, right? So we can get a better sense of where we're not, of where there's more scooters and people are moving about, which streets they're taking, things like that.
Like someone related, can you explain what the bike aid program is? Because I feel like it's very related to this, and I don't know, I love that program.
Yes, that's awesome. The Bike Angel program, it's a way to help the system, help all of Bike Town by bringing bikes back to stations. And so that cuts down on our staff in the field through Bike Town, switching out batteries, taking bikes, fixing bikes, things like that. So if there are more bikes concentrated at stations, it's less of a footprint.
And you guys are free.
Well, you get points, so there's a whole gamification point system thing that you can get 3 points here, or 2 points here if there's more need, depending on those kind of factors, and then you get, I think they even upped it to like $1 off a friend and then $1.50 for one Lyft ride, so they're trying to bring it all together and give you kind of for a Lyft car, because
That's where I get a little bit of conflict of interest there, right? Like how you got right share company and bikes and how that's kind of overlap.
Yeah, and I mean, they're trying to handle all the non-single occupancy vehicle use, right? So that's that shared micromobility with also with ride share.
Right, which is, they don't do shared rides, right?
Okay, what happened with the shared, I guess after COVID, that was, yeah. Okay, so, how are we on time?
We're doing good on time.
Okay. I mentioned we set up outside of clinics, reached a few people trickling in here and there, and then we're out at high schools. And this is what that looks like. Here's some of us in the park on rainy days, signing people up. We went to lunch time, which is super hectic. We went to a science class. We went to different classes. Like there's different programs that we've been connected to now through Safe Routes to School. So this has been super rewarding, and they remember us, and they've got great things to say. We see them writing, so it's been a really good connection. I mentioned we did lunch pop-ups, connected through teachers, classroom writing. Here's a little bit of data, just showing, you know, what I mentioned around McDaniel High School, like the bikes in the morning, and then at 3, the ridership before engagement and after youth engagement. So just kind of showing that some of the things that we're doing is doing something. Yeah.
Okay, try to do this through my company. How do you know 16 or 17-year-olds have an account? Is it that they have an account for the school and you have school sign up?
We work with on that, so Lyft can report that.
Lyft is allowed, okay, so they're allowed to have, they have giant legal teams. My company's legal team is not as big, and they said, too big.
Yes, we do share aggregate data. We tried a series of community rides. There's a lot of community rides going on in Portland through the summer. I think we realized that it was too much. It's a lot of staff support. It's better to connect to the things that are already going on, Multnomah County's rides, other things that have staff support. We definitely got some great riders out there, smaller groups, so it felt like we could really get to know folks. We all rise leading rides for a year. We had community cycling centers, Dando en Bicicleta y Caminando, ABC. They helped us lead rides for a year, and then yeah, there's just been, there's so many rides that are, so we're just trying to connect folks to those things that are going on. We've developed a bunch of materials. We have a packet of goodies that explains the program, shows you what the laws are, how to fit a helmet, all that kind of stuff, just to provide. And then we also communicate through text, which has been helpful, especially trying to learn when people have issues with their account, when they can't reach somebody customer service. There's been a lot of great communication that's happened through text and email too. Yep.
Is Lyft text something that's Lyft built for you?
No, it's like a service.
Extra.
Yeah.
That would be too good to believe.
Yeah. We just decided to try it out for this program to see if because there are a lot of medical, like clinic stuff, there's a lot of reminders and tags, there's a lot more, you know, so we wanted to kind of play into that. What about them? What's going on?
Did they get their contract renewed?
So, good timing, yeah, good timing. So we have two operators that are going to be operating. It'll be Lyft scooters and Lyft bike-town scooters and mine. It's been all the questions. Love
No one
it.
writes school anyways.
The data would tell.
The data isn't that. They only have ridership in places where there's no e-bikes. For some reason, people thought it was a better idea to have standing things than sitting things.
I would like to check your sources on that one too.
All right,
You say it loudly, so.
Okay, all right. I need to, before you check out, yes, Seattle has more cheaper rides.
Sometimes people ride scooters for fun and not for utility purposes.
And you're clear.
Yeah, that's what I mean.
Because I know
That's still for
that,
fun.
I know that Lion had a video that they had, that instruct people who work for them. elderly folk, like those sidewalks, stuff like that. But I don't know how much effort required before you get approved to start using this. And I don't know how, if that part of your clinic.
You are ahead of the game. You're in the future, you're living in the future, we're living in the present, but I'm gonna get to that, yeah. So just to backtrack on evaluation, I mentioned we're trying to get this going, get this partnership going, try to see how we can expand, look at the data, see what is worthwhile, what a good investment looks like. We want to evaluate the whole process of this. We're planning to put some data and information out next year, so look forward to that. Some of the numbers, our goal was 150 participants. We reached 257. And that was, we were able to adjust that by seeing how much was being spent, and have that flexibility within the grant, which was really nice. So we got to work with more folks. 14,000 rides, bunch of miles. It's been interesting to see that a small percentage of folks consistently have been riding about 50% of the rides. So there definitely is the power users, and then the folks who are not riding, and then the folks who have ridden once or twice. And so it'll be interesting to see these stages of behavior change as we dive into the why, not feeling safe, not knowing about community rides, where did we fall short, are there other places that we need to fill in to get more of that consistency.
As like similar but related thing, I've often heard the criticism of employer trying to pass program, they get like 3 trying to pass the criticism that all you're doing is taking people who are already either trans riders or cyclists and using them to free ride or whatever. So you have like good evidence that demonstrates that folks who are prescribed like to do activities for them is like you can just demonstrate the increase that not finding people in the way riding.
Say that last part again.
Like, are you able to share, like, not share, like, are you able to collect data and demonstrate, like, these are new cyclists, these are people increasing cycle usage as opposed to finding, like, already interested cyclists?
You mean within this cohort?
Yeah.
Yes, so that's one of our big questions is, are you new to biking? What's your relationship with biking? How many times have you ridden in your life in the past 2 weeks, whatever? So some of that trip diary includes in there.
And so the data is, in reference for ethnicity, income.
Yeah, so since we're working with REACH, our focus is Black Portlanders, Black and Brown Portlanders within the service area, because we're kind of limited to that, but also it's open to all clinics. And as far as, what was your second, and everybody in this group is low income.
Have other municipalities expressed interest in a program similar to Bike Town or wanting to potentially expand the service area? I know it would be difficult because it's under PBOT jurisdiction, but.
Yes, and when we were working with like Grow Learn in Gresham, having to bring them to us because the bikes were not there, and then we did bring them to Gresham for Juneteenth twice, and that was a big lift, but it was fun, and then it got folks saying, where's our bike share? So that's kind of the things that happened. The random displays for residents of like, there's this bike town bike in my front yard in Gresham, and so, that's Gresham, and then Beaverton, there's Nike, and Nike has their own fleet on campus, but there's plenty of folks that to expand as well, and so that's the future too, hopefully, is a metro-wide, simply spread out. I mean, first Portland-wide would be great, but metro-wide, if there was significant sending of cash monies, that would be the dream.
All
Do you
your-
see-
all your bikes are limited. Because you have to.
Oh, maybe with the throttle,
I don't have.
right. We are trying to push for a little bit of physical activity, they're trying to make that connection. We are trying to do a little bit.
You don't have to pedal asphalt, I would never pedal on e-bike. Yeah, the first time I rode, I was like, oh my God. Going up the hill, it was, I just didn't believe it. I'm like, what's it so hard to get up this?
And that's part of bike share, right? That's part of these things that we're learning there. This is our gateway drug. This bike share is the gateway drug to e-bikes, and that's why we're prescribing it, right? Like, this is a way to get people more comfortable and say, you know what, this is an option, and maybe this is a better option, and maybe I can cut out 1 or 2 trips from my car a week, and then maybe it's more, and then maybe it's more. And so I think that's part of the systems change, part of the work that we're trying to do is trying to bring people to that while also staying focused on the personal experience and how that looks across the city, how that looks depending on who you are, and connecting not just safety, but other programs like working with our office of violence prevention, for instance, if that's the thing, working with other schools, showing this can be an exit strategy if you're in an unsafe situation. Some of our younger riders have told us, I don't like walking through there, but when I'm on the bike, I can move through quicker, right? So just like those bits of information to help us know, these are places I don't feel safe, this is how I move about, this is how I avoid it. How do we show folks the right ways to move about where they feel safe, right?
Do you see an opportunity to work with municipalities that want to create a bike share program to help them navigate the process of setting one up and sharing some of the lessons that you've learned throughout the history of bike town?
You mean in this area?
Yeah, within
Yes.
Portland metro area.
Absolutely. Love that.
Recognizing that not everyone can pedal or is able to pedal, but also still being able to get out and be able to use some sort of micromobility, like Ryan has for seated scooters out here. Would you consider it still being outside as a mental health benefit for your health? And would you consider expanding the prescription to other forms of micromobility, given the broader benefits that people could get from them?
Yeah, I mean, I would love to connect the veggie prescription to the bike prescription to the scooter prescription to every, I think that there's something to all of it, so it would be nice to show some data, show that there's something to connect to, because I do think the education and safety piece with scooters, they have, like you mentioned, they have, the videos and things like that, but how many times are people just clicking through or just trying to get to the piece, so how do we make that a little bit more ingrained?
Is there, I don't know if this is a fair question, but is there potential for it to be run by a state agency like TriMet or by Metro instead of sort of offering it to lift to run, which causes problems and they're allowed to raise the price, for example, or the number of bikes and things like that?
So when we're at the end of these contracts and we have this request for proposals, it's really who shows up for who has a proposal for us. So if TriMet had a proposal, so it's showing that you can run a program you have, and that's where the VC money comes in. So. Okay, so we're good, okay. So moving forward, you kind of hinted towards this, we want to set up an online learning module, so some kind of 5-minute education piece. We're focusing on students. We're going to be working on that in the winter time. And for the folks that can't go through the 6-8 week transportation academy class or whatever, they don't have access to enough space in their thing, but we still want them to have that information. And it's kind of gonna allow us to automate the sign up, so someone will learn the thing, have your little checkpoints, take your quiz. You get 100%, you get a certificate that says, congrats, you can now sign up for Bike Talk for All. Click on this link, enter this promo code. Do you have a prepaid card? Yes, no, here's a number, this is how you sign up, and then they can go on their way without us having to be a part of that. So that's one thing coming up. Evaluation, as I mentioned, that's the winter project and next year project, and then finding new funding opportunities, and then continue to adjust our workflow in clinics. I think we finally started to figure out the workflow in each clinic, and it looks different in each clinic, depending on if it's a referral specialist, if it's interns that are, working in the weight rooms, if with their TCAs, there's different folks at different clinics that are championing. So we're just trying to find out that flow for each clinic, and it looks different depending on staffing and how they work. Yep.
Are these clinic memorials, these clinics, like private companies?
Multnomah County Clinic, so North Portland Health Center, Northeast Health Center, La Clínica de Buena Salud, Southeast Health Center, Mid-County. Questions?
And those forms, that's one also, like,
E-scooter ridership stayed the same year over year, and bike ridership increased by 20% for sheer fees
For Portland?
in the US. And partially has to do with the trending decreased cost of scooter ownership. So scooters have gotten cheaper, so a lot of the people who go to programs are now buying their own. The most common scooter riders are tourists, and e-bike riders are reliable. At least for the kids. Right, interest group bike. Who? Yeah, that's.
Great, you're
I'm very, I just read
It sounds like there's a lot, there's a lot happening that's fluid, so understandably there might not be an answer to this, but is there any thought to transitioning folks from bike now to promoting their own bike? So getting them on bikes, comfortable with bikes, comfortable with their routes, and then sort of figuring out a way to subsidize their work in, like maintenance clinics, things like that. Clinics, how to work on a bike and get a bike, things like that.
Yeah, I love that. I think that is a path to go for sure. There is going to be a bunch of money from the Clean Energy Fund towards e-bike ownership, so thinking.
right, we just launched this program now, they going to expand free e-bikes to people, but they have to be in the program for a year.
That's the We All Rise program, Street Access program.
After a year, they're they start doing their program.
Right. So, yeah, so partnering with things like that. I think part of what we've learned working in the communities that we have with affordable housing, for instance, safe security, where you're gonna store that bike, how you bring it upstairs, those are all things to consider. So bike control is a good option in a lot of ways, but there are spaces like where the bike service area doesn't extend to, or other times where people just want the leisure, they don't have many bikes here or something like that. So I see it.
Affordable housing project now. Dealing with bikes.
Yeah.
And the place value in your apartment, your bikes, right?
That's amazing, if you can carry it up there and do all that, I can't even, I struggle on the bus, I can't.
It's a requirement, right? It's a big requirement in Portland. I think until recently it was, we have to require bike parking of some sort.
For new development.
Maybe not, no.
But it's fine.
I personally like ride programs regardless of what you like. When I go to city, I can get to and from, but also a lot of times not symmetrical. So you might need to go somewhere, meet someone, walk to the next place. Yeah.
You might wanna, get a ride, or you might wanna ride to the bar and then stay for a ride home, ride home, like, there's a lot of different use cases for riders.
I literally got a flat on the way here, so by camera.
There you go. Go, find some shop. You wanna ride to the gym, trying to get to work, all the things.
Any more questions? Thank you.
Thank you.
How about we break for 10 minutes and come back at 8:30? We have another 10 minutes. Just to go through a couple of questions that we have for you as a class in response to the presentation. So, yeah, let's break for a few minutes and come back.
It's right outside, I think.
There is-
There is water fountain, but it's like you have to get water. It's right on the.
Yeah, thank you. I just
I
couldn't keep a crazy week. Oh, yeah, that's
Yeah.
Okay, thank you, thank you.
Luckily, I opened this in a Google Drive today, so it was easy just to add it as a.
It's been such a busy week for me. I haven't even but
Yeah.
I figure you know what you're doing, so.
Yeah.
Are you gonna show up on Saturday?
Yeah.
Okay, okay,
So
great.
I won't be available for lunch, but
Okay.
I'll try to meet you at the coffee shop, if not at home.
Yeah, I just wanna offer up the coffee shop for
Yeah,
folks,
yeah.
so we'll do that. I wanna mention a few things, and I haven't talked to you about it, but for the,
So let me.
This back to you. And I know there's so many amazing conversations taking place. I really do want to meet, so, I still want you to continue conversations, but we did list a couple of questions here. Four of them in particular, from what you heard today. I want to talk about, we can talk within your group, within each, with your classmates and each other, but I think I just want to open the dialogue. From what you heard today, how does this resonate with you? How does this create a ripple effect as a community member? All this is built upon one thing after another. How can community members, what can community members do to continue the advocacy work? All this you, and I love how you mentioned you guys are all leaders here from your seat. You're all leaders. You guys know a lot more than I did when I was in college about NACTO and FHWA and all this great stuff. But yeah, I think the research you've done from listening to our speakers today and previous speakers, think about what you've heard today or even previously. How do you make our streets safer for our Black and brown communities? I think ultimately that's like the key to this class. The equity component of it, it's like how do we navigate through the system? How do we be allies to our vulnerable communities? How do we make streets safer so that you can get out with your son and ride your bike, and you don't feel there's no fear. So anyway, I want to bring us back, but I also love the dialogue that's taking shape. So continue on, and I'll give the class back to you. There you go. But before that, see you Saturday.
Yeah.
Yes, I'll see you Saturday. And then we break for Thanksgiving, is that correct?
Yes.
We break for Thanksgiving, so there's no class. And then after Thanksgiving,
We see you next week. Yeah, I think there's one more.
is there one more?
Next week would be next week.
Oh, the 18th, okay, the 18th, So the 18th, we've got Ashton Simpson and Rakaya Adams, both who are really good friends, dear friends to me, and Judge, so we're usually in for quite a night. It's been such a fun class to lead. Having some amazing guest speakers, having you here. But yeah, I just wanna kind of figure out the timeline and everything, but meditate over these questions, talk amongst yourself, and have a good evening. Thank you.
Thank you.
I can respond to this. Transportation, but I mean, there's the work.